In taking care of patients who've had multiple spine surgeries, what I've found is typically there are three broad categories of patients who come in. No patient sets out going to have 15 spine surgeries. No surgeon sets out trying to do 15 surgeries on the same patient. Usually what happens is one of three things. You wind up having too much surgery or too little surgery. And I don't say that as a criticism of prior surgery, because sometimes there's no clear-cut pathway of exactly how much surgery to do. But looking back at the films, you can say, well, I might have done a little bit more, or I might have done a little bit less. A lot of times you'll say, look, I would have done the exact same thing, and the disease keeps coming at you. And that's the second category. Sometimes patients have more and more problems. A tumor keeps coming back, or degenerative disease from an old injury keeps recurring, and you have to deal with it. The third category is not having a good plan going into the surgery, and typically that comes from not having good enough radiology. A lot of open MRIs are very poor resolution and don't really allow the development of a detailed plan that addresses all the subtle nuances of a given patient's spine. And with the imaging that we have here, we have some very high-resolution studies as well as very good protocols that help us identify some pathology which may have been missed on other studies. If they don't look with the proper level of sophistication, they might not necessarily see the problem. So having these protocols here and these imaging studies has been very beneficial to us. I'm very fortunate that I get patients referred to me from around the country and around the world. And actually, on a daily basis, I'll have patients from overseas who will send me their films for an opinion or an evaluation. I also go to many other meetings, and I can't find another institution that has the quality of imaging that we have here. So I think it's a really special thing that we have here, and it really allows us to do a much better job for our patients.